who determines or what part of things, again, with cancer, it all depends on the stage and the workup, kind of, when are you seen or when are you diagnosed? Sometimes unfortunately it's too late to kind of say, we're going to do something that is for cure or something that we can manage this cancer in a way that we are going for that. Sometimes it's just for palliation and that type of thing. But for the most part, we do have a certain guidelines or certain set of ways of dealing with patients and managing their care. And I would say majority of oncologists, radiation oncologists, surgical oncologists, medical oncologists, we all go by these guidelines. I mean, of course, there's going to be some patients who are, outside of that or need special care, and whether they can't tolerate chemo or can't tolerate surgery or radiation, we may have to do something else. But at the same time, you can kind of work with what you have. So, and again, and Nurse Navigator is important because, again, they find at that point to say, hey, you know what, this patient needs this done and needs to be seen by this doctor. And so, we all kind of work within certain parameters. And I think just having everybody involved, and again, sometimes patients are not candidates for a certain type of treatment, but it's good to know because, again, sometimes other doctors, we get blindsided. We only see, or, we only focus on what we do for the most part. And sometimes it's good to know that, this patient may not be a candidate for this reason, or maybe a candidate for something else, so we're always learning.
Dr. Ray said guidelines, and typically every woman write these initials down. It's called NCCN, and it is a National Comprehensive Cancer Network. And so Dr. Ray, as he's doing his analysis, always you can say, and I never say this in the medical world, there's always something new or different that you need the expertise of someone else to say, how was your typical treatment? That NCCN guidelines is in the cancer world, oncology realm, is the guidelines that every reputable physician is following. And so that NCCN guideline is what we go by, but understand we're also evaluating the patient. So Dr. Ray has a guideline of when he's beginning radiation of what dose he is beginning with for a patient. But if there is a change, ladies, and if there's a gentleman on listening, if there is a change, then Dr. Ray will adjust for that patient. And so as a navigator, and I think one of the questions was, how does navigation go into play? Navigation is basically set through individualized facilities. So navigation is a new realm of nursing and relatively new, in that along the way as a nurse, we were always navigators, and nurses are always navigators, but it's the concept of now when they leave the hospital, who is making sure the continuum of care is occurring. And in navigation, you have navigators that are registered nurses, and then you have lay navigators who, in some physician offices, they have a navigator. So once you're diagnosed as a patient, you can ask about navigation. In some cases, there is a navigator that is set up in the hospital, in physician offices, and then in corporations or companies, they have navigation. And so when you're looking at the guidelines and the navigation and the process, you should have a care plan in front of you that reads, this is where we're starting from. This is the estimated time of when we're starting. But understand, we're individual. So I always explain to ladies, if you have in mind you're getting chemotherapy every 3 weeks, don't hold to that, because we also have to evaluate. So if a doctor says, no, not this week, and you have a cruise plan for next year at this time, you should hold that money. I'm not saying you can't go on that cruise, but understand your health is being determined each stage of the way. And Dr. Ray is not giving himself the overall credit in that he is brought in as a specialist from, you have the primary care, you have the medical oncologist, you know, you have different modalities along the way, and they say, we're going to send you for a consultation with Dr. Ray. And he's going to sit down with the patient way before radiation starts and ask questions. And then he's going to propose, you know, this is the treatment plan I have in front of you. But then he's going to have people on the team that say, these are the things to prepare you. Each time you come, we're going to ask you the same question. Just as I tell patients, answer it, because that's following through. So there are certain pathways and certain guides that Dr. Ray, you know, his expertise in his area, sometimes we look at, are we noticing a group of women that are occurring with this type of cancer in this area, or is it the whole population? Is there something that is triggered more in one area? Is there something, you know, such as genetic that is showing up that Dr. Ray is saying, oh, did I take care of your cousin or your mother? Then he starts to look, and he might, as a radiation oncologist, go back to medical oncologist and say, here, I seem to have a family of people. Have you tested or checked someone else? So Dr. Ray is, even as he completes, as people say, well, I'm done with 4 weeks of radiation, he's sending a synopsis of what he's done in his recommendation. And that recommendation changes to, is this patient ending treatment, or are we looking at another modality? Because his expertise also includes doing a CT scan to evaluate, looking at all of the prior information. So it's a continuum. So we believe that cancer is going to play fairly, and it does not.